name is Ezekiel Oburu. I'm an orthopedic surgeon at Nairobi Spine and Orthopedic Center, and today I'll be talking about some of the conditions that affect the hand. Now, sometimes we get patients who come to us with numbness and tingling of the fingers, and they may complain that this wakes them up at night, and sometimes they have to wake up in the night and shake their hands, and that does give them relief. So one of the common conditions is called Carpal Tunnel Syndrome. Now, Carpal Tunnel Syndrome is a condition that affects the hand, and usually it affects these fingers, 3.5 fingers. And what the patient will complain is numbness and tingling over these 3.5 fingers, although sometimes they may complain of numbness and tingling of more than these fingers, the details of which we will not go down to explain at the moment. So what happens in Carpal Tunnel Syndrome? In Carpal Tunnel Syndrome, we have entrapment of the nerve, and entrapment is basically the nerve is squeezed in the carpal tunnel. The carpal tunnel is a structure that extends all the way this way, and in the carpal tunnel you have a number of tendons. So all these tendons are for allowing the fingers to flex. So you've got a number of tendons, we call them the flexor tendons. But within the carpal tunnel there is a nerve. It's known as the median nerve. So the median nerve traverses through the carpal tunnel, and it will supply 3.5 of the fingers on this side. So the patient will complain of numbness and tingling of these fingers, although sometimes it may be slightly more different than that. Now, they may also complain of some sensations that go towards the upper side, especially the forearm. So what do we do when we get a patient with carpal tunnel? There are a number of tests that we do. Number one, we examine both hands and we try and see which are the areas that are affected. So we may try and see, with a pain, or with we just want to see, is this, we ask the patient, where do you feel better? Do you feel here or do you feel here? And we compare also here and here, because this side of the hand is supplied by a different nerve, which is known as the ulnar nerve. And sometimes the patient has got classical symptoms where they say that they feel numb here as compared to here, and if it's not on both sides, they would feel numbness here as compared to there. Sometimes also we ask the patient, are you feeling numb here as compared to here, because this area is not supplied by the median nerve, and they may say the sensation here is better than the sensation here. The other thing that we do is we could inspect the patient and see if the patient has got any wasting of the muscles, and this area specifically is the area where the muscles may be wasted, because they are supplied by the median nerve. There are a few other tests that we do in a patient that's got Carpal Tunnel Syndrome. One of the tests that we do is known as the Tiniel Sign, where we tap over here and we ask the patient whether or not they have any tingling sensation, in the fingers. Or we could do the Fallen Sign, among others, where we just do this, and sometimes we're having a conversation with the patient at that time to distract them. We can do this for half a minute to about 1 minute, and when we stop, the patient has got quite significant numbness and tingling if they had carpal tunnel. So what's the test that we do for carpal tunnel? The test that we do is known as a nerve conduction study. And once the patient has had the nerve conduction study, we can have a conversation with the patient to determine how we will go about treatment. What are the treatment modalities? Number one, we could just give a patient a wrist brace, and the patient will wear the wrist brace, especially in the night, and that will keep the hands extended, so the patient will not experience as much symptoms. Sometimes we can give an injection, and the injection we give it over here near the carpal tunnel. I don't like giving this injection because the recurrence rate is pretty high, and sometimes we do surgery, and surgery entails release of the carpal tunnel. It is a procedure that can be done under local anesthetic, and the patient can go home the same day. Usually it will take a few weeks, for it will take a week or two for the healing to happen, and for any pain that may be left there, sometimes we call it pillar pain, up to 3 months for it to go. So that in brief is carpal tunnel syndrome. It is quite a common condition and may be missed if the patient or their doctor is unaware. Thank you very much.